Welcome back to episode 3 of the AI4U podcast. We've done a lot of stuff. We've talked about prompting. We've talked about some broader ways of building kind of systems. Today, Jie Tao will tell us about how he first built an exciting product called a Health Buddy, and all of the prototyping and the planning and the pain that comes with it.
The mistakes.
And the mistakes. So there's a lot we'll learn about here. Jie, tell us.
So you think a PhD will prepare you for anything, but at 2 a.m. after hours of medical research for your loved ones, you just feel exhausted. Not only exhausted, these medical literature reads like alien to you. You feel pure helpless. You need help.
Yeah, it's a problem everybody has faced. One of the beautiful things has been ChatGPT. You can upload scans, you can upload blood work, right? And it could do some stuff. Mm-hmm. But like you said, in a sense, having a PhD makes it worse, right? Because you feel like you should understand. You're so close. They're using statistics, right? We understand statistics. Yeah. And yet a lot of their methodology, their selections about the people they look at, there's contradictory stuff. It's really hard to make sense of. Mm-hmm. Let alone the specifics of your case, right? Yeah. Connecting that to the broad knowledge that's happening in the world is an incredibly difficult thing to do. The contradictory findings, the weird sample biases, the publications, some of them are published, some are not. Yeah. And if you throw in homeopathic stuff, forget about it, right? It's really hard. How did you, I know you built this amazing thing, Health Buddy, which is what we're going to talk about today. Yeah. But it wasn't always in the form that we see it today. No. Right? On the other hand, when you were up at 2 a.m. and you wanted to build something, how did you do it? What was the first thing you did?
I think, I just need help, right? When I feel helpless, I just need help like everybody else. And one thing I realize is I know a little bit something about AI. And I should use AI to help. And that's what we've been talking about last episode is we want to automate things we do that's either tricky or repetitive with AI. And we're trying to use AI to elevate what we do. So the initial idea is I trying to understand what I am doing, right? And what's stopping me, right? That's the elevation point. So what I'm doing, I do a few things. First, I need to do a very comprehensive web search. Like you said, we need different views. We also need to capture the up-to-date information about a new drug release, a trial treatment, all these things, right? And we need to make sure they're from, reputable sources. So, so we can trust them. Right?
So the first thing you did was you noticed what you had been doing manually.
Yes.
And trying to automate it or trying to formalize it or figure out what your own human workflow had been.
Well, first I need to look at, what the human workflow is. Mm-hmm. And some of these, and I have to make a judgment call, some of these can be automated. And some of them cannot be automated, right? So I'm trying to automate whatever I can. For example, web search can be automated because we just, like we said in the last episode, you can give web search as a tool to your large language model so it can search the web for you. So that's the first step. But even before the first step, I made a decision. We don't really want the user to interact with the model that much. We want the model to take over the work, the heavy lifting for the user. Basically, you just say, I need to know everything about this condition, right? Mm-hmm. And the model will figure out, okay, so maybe the user want to know about trial treatments, maybe want to know about, side effects and all these other things. It will figure out, the keywords to do the search. So that may be step 0. And step 1 is an agent, what I call the researcher, will actually go out and collect the information through web search based on the keywords.
So your initial view was like in the Matrix, right? When he needed to learn Kung Fu. You just want to download everything about this condition up to date. Yeah. That's the interface, the design choice, right? Yes. It could have been different. It could have been I want it to be interactive. But you thought the right way was not interactive because
The initial idea is I don't want people to spend hours to chat with a chatbot, because that's not saving you a lot of time to from your manual search. It's saving you some time for sure, but it's not saving you a lot of time. What I want is the end product is just a summary. And then you glance through that for 5 minutes. Worst case scenario, you wasted 5 minutes.
Makes sense. And it's organized nicely. So if it's a side effect you don't care about, you just scroll down. Right?
Exactly. So step 0 is finding these keywords. Step 1 is doing the search. And then, if you look at, all these tools, ChatGPT, Grok, Gemini, they can all do one thing called deep search or deep research. Right? They can actually go out and search the web and organize the information, the way you want. What we are doing is nothing new from that, at least till step 1. That's nothing new from that. Then, a lot of people would say, well, why don't you just use that? So what we actually bring value is after the researcher will bring another agent called the reviewer. So what we want is, when we do deep research, I'm sure some of you at least use deep research. And with deep research, you will have to manually review if this is, from a reputable source, if it actually has references to something. Does it have the data you want? Does it have, exact statistics, for example, right? And we want to also automate that piece a little bit. Because the tricky part, the reason I'm spending hours and hours is I don't have enough medical knowledge, right? I know the condition with my loved ones. That's all the things I know, basically. And I wasn't trained as a doctor in the medical field. I don't even have enough background knowledge to see, okay, this is something useful or not. But AI does. Clearly, AI has more than me. So by introducing that second agent, the reviewer, into the play, it will look at what the researcher had put together and say, hey, maybe, you shouldn't talk about this, or maybe you shouldn't use this source, or something like that, right? So it's providing feedback to the reviewer.
So just to clarify, to put it back in the broader context you talked about in the past episodes, the first step, the search is something you were doing as a human, but the review was not something you were really doing as a human.
Yeah.
So this is the elevation.
Exactly. It's something I want to do as a human, but I am not able to do it as a human. So if you put it that way, the researcher is basically the automation part, but the reviewer is actually the innovation part. And the other thing we want to add is basically we want to actually make sure any human user wouldn't read any of these reports until the AI reviewer is happy. So we actually do the review in an iterative fashion. Okay, the reviewer will send feedback to the researcher and say, do this and that instead.
And how does that loop get resolved when the reviewer is happy?
When the reviewer is happy. So when we say agents, they have the autonomy to make a decision, the reviewer will make the decision, okay, this is good enough. We can move on.
And maybe this is a overly technical point, but is it the case that the reviewer as an agent then calls deep research, or is it an outer loop where he says, I'm not happy, and so the loop continues with the researcher before the review continues?
So that's actually a good question. When I first started, I thought I can use one agent to do all these things. It can do the research, do a self-review, and do the research again. And a lot of time, that's how deep research is working. It does have a built-in review process. The problem with that is a lot of academic research have suggested self-review or self-reflection is a powerful tool, but it's not as powerful as have a peer review. So that's why we introduce a second reviewer in there. So it's no longer a monotone. It's no longer, I shouldn't do this, I should do that. It's you shouldn't do this because. So a lot of academic research prove that's more important or more effective.
But do you use the same model for each of them, the same underlying like Gemini or whatever, or do you also switch those up for different parts of the agents?
that's an interesting part because for the research, it's actually an easier task comparing to evaluate. So for the research, we're actually using a smaller model for speed because we wanted it to do fast research, right?
Yeah, because the deep research on the big, they take like half hour or something,
Yeah,
right?
yeah. So we're using basically the smallest model we can, so it will complete the research part fast. But the reviewer is actually a very difficult task. Evaluation, meaning telling an agent or a human is doing a good job. That's a very difficult task. So
The reviewer doesn't have access to the internet.
it does.
Oh, it can also search.
It can also search. So that's how it can verify if some stats is correct or some things like that.
Amazing.
So we're using the largest reasoning model we can find, and ask you to critique on the research.
Okay.
And that's only one link in this workflow because we're doing this every day, 7 days a week. Well, I want to say 24/7, but it's not 24/7. 24/7 is not very efficient. So basically, it's 5 minutes every day. It will for each condition.
It'll do the whole thing or just the review part or everything?
Everything, the whole thing, 5 minutes. So that's how we optimize that. Well, initially it wasn't like that. It's actually much longer, and we'll talk more about that later this episode. And then after 7 daily reports, the user wouldn't see the 7 daily reports. We'll have another agent coming in, read these 7 reports, and put them together as a summary, a weekly summary. And that gets sent to the user. So every morning, 8 a.m., that summary is laying in your inbox for you to review.
Once a week.
Once a week.
And so you have 3 agents: the researcher, the reviewer, and the summarizer.
Yeah. Yeah. So that's the bare minimum of that workflow we put together. So you can see if we tie it back to episode 2, the researcher is the automation part. And we already said the reviewer is the elevation part. It's doing something we cannot fully do. And the summarizer is also an elevation part because, if you do deep research, say every day, then you have to remember what's going on yesterday, what's going on, day before. And then you have to manually summarize this together. Okay, this is the new drug, and this is something going on. And maybe you don't remember all these things. And why should you remember all these things? Right. Clearly, you can put your mind into something more valuable. So by doing something like this, at least my dream was, instead of spending hours and hours every day, you spend 5 minutes Monday morning, maybe during you enjoy your coffee or tea. And if it's useful, great. If it's not, then it's not. You waste the 5 minutes.
And it's obviously very generalizable. You just give it whatever particular disease you're interested in.
Exactly. So it doesn't even have to be a disease. It's any kind of health condition, mental or physical. It should be able to handle it.
That'd be amazing. Now, I understand you raised $100 million and hired 50 people to build this over the course of 6 months. Is that about right?
Well, I would love that. I would love that. But everything actually was built by me.
Unbelievable. How is that possible?
Yeah, so it's very interesting. A little bit background. I started coding since I was 8, right? So in my 30-something years, I built research prototypes and portions of a larger system, just a part of that. But I never built something end to end because I was never required to. Even as a software engineer, I always work in a team. So this is a big challenge for me. Even I'm no stranger to coding. This is a big challenge for me because how to build something end to end. You have to plan everything out. And this is something what we call, basically we're using AI to build this AI tool. I have an AI coding partner that helped me actually build this whole thing, at least the gist of the whole thing in a week.
1 week?
1 week, one person.
Wow.
One AI, of course.
What was the AI that you used?
So when I started, I was doing research because I was new. And actually, before that moment, I was proud of myself. I code like my grandfather did with both my hands, right? I write every single line of my code. Well, my grandfather never coded. But, then I know efficiency-wise, that's not the right way. So what I did is I started researching which tool, which model is best for coding, and back then until this moment is still Cloud from Anthropic as the best coding model. So I use that model as my coding partner. So and that's something I think is interesting to talk about. And everybody, and I think still they're talking about vibe coding, right? That's a very popular thing. I'm sure some of you have heard of that. Vibe coding is a very amazing thing.
What is vibe coding?
So think about this: you just need to have a vibe, right? You don't know how to code. You don't know the details. You don't know the specific. You just need to have a vibe. I want to build an app that doing medical research on the internet, and basically, an model, a large language model, will help you carry out that vibe into actually working code. That's the idea.
Okay.
So, and later on, I'll talk about, what I'm doing is basically slightly different from vibe coding, but I do want to say a few words about vibe coding. I think it's amazing because now everyone can be a creator. You're no longer limited by your technical understanding of coding because you just need to have that vibe. If you want to create something, if a startup, a business idea, and take startup businesses as an example, they always struggle to find a tech partner, right? Who knows the tech, the how to create the MVP and things like that, right? Not anymore. Now you can use vibe coding, you can use AI, you can use large language model as your tech partner, right? Even as your de facto CTO. And build the MVP and show that to your investors. This is the golden age of creating something.
So so vibe coding, I agree, is really good at building minimal viable products, demos, prototypes. But we've seen there have been some apps that have been released probably that were vibe coded that terrible security, leaking keys and private data all over the place. So is it still? Can you still use it for production, or is it something that's best used for prototyping?
So I always say there is an 80-20 Pareto rule here. Vibe coding will get you at best 80% there. And for demos and MVPs, 80% is more than enough, right? 50% is more than enough. But for production, that 20% actually makes the biggest difference. It makes or breaks whatever you're building. So that's the key difference I'm talking about. I think what I did was not vibe coding. I call that AI assisted or AI paired coding.
Okay, so for vibe coding, you talked, I think, in episode 1 about like raft and roles. And why can't you just, in the vibe code, tell it you are an expert, cybersecurity expert, world's greatest programmer. You're not going to make any mistakes. You're not going to have any leakages. You're making this into a production-worthy code. But that doesn't work for some reason, or does it?
It doesn't work, and later we're going to talk about, actually, I experienced the same problem when I'm building the researcher and the reviewer and the summarizer is prompt doesn't work as hard constraints. Then even if you word it very strong, it's strong suggestions. Like, like the advice you give your kid, right? Don't do this. You think they will never do this? Well, if you're lucky, right? So it's the same thing as vibe coding, and a lot of times is specifics. You don't make any mistakes. What do you mean by any mistakes? And a lot of times think about what we use to train large language model. How many mistakes did it see? And did we but did we actually tell it that's a mistake? Don't do it.
Right.
Right. And a lot of times we don't see that. Right. And that's, I think, is a big problem. And with with AI assisted coding, I think that's a little bit different. That's I didn't start from a vibe. I actually started with a system design. I know I need 3 agents, right? I know how agent 1, the researcher, will hand off the work to agent 2, and things like that.
Okay, so this first week that you built it, AI assisted, super vibe, whatever you want to call it, you had already architected it. Was it your goal or your expectation that it would be perfect after a week?
Well, that's clearly the dream, right? Everybody wants to one-shot things, but it didn't. Big surprise.
But your expectation, you thought it might? You thought this would be done in a week?
Yeah, yeah, of course. It will be done, and I do want to take the chance to see I didn't. I said I did this by myself, but I didn't. Well, I did a. I got a lot of help from the internet, right? And particularly somebody like IndieDev Dan. Actually, the first version of Health Buddy is from his single file agent repo. I actually built everything along that. Well, big shout out, to him, big fan. But back to your thing, I did hope, because from what I learned, all this information I collected, from the internet, they did show some success. So I was hoping it would work, but it didn't really work as expected. The weekly report looks brilliant, but it's not really there. It's bluffing.
Wait, like hallucinating?
It's not hallucinating. We actually caught a lot of hallucinating through the review process, because we're asking it to ground it based on internet search. So that's helping a lot. But it's bluffing. It's basically not yielding as valuable information as we thought. It's well formatted, it's well versed, but it's not, there's not enough meat.
It's not insightful.
It's not that insightful. Exactly. It's not that insightful. But, looking at that, I think this is also a great learning experience for me. I think, I took this as a learning opportunity for myself, because like I said, I never did AI assisted coding in myself. So I need to up my skills to that level, right? I need to know. So why can I talk about, structured prompting? Because I learned it that way. I learned it through building real things. Why did I know how about, handle my context, for example? Because I have hundreds and thousands of lines of code. That's all my context. I need to direct my coding model, coding agent to, certain code and say, fix that, or build this, or this is not according to the plan. So, I think the best way to learn this is actually getting your hands dirty and do something even small, even less technical. We have a lot of no-code, low-code tools that you can actually use. And I think that's the best way. We're talking about this for multiple episodes now. I think that's the best way to up your skill when you feel you're ready. And believe me, you're ready. You're ready now.
Interesting.
Yeah.
Okay, so your first prototype was, I like that phrase, learning engine.
Yeah.
Learning mainly for you, right? The AI doesn't learn.
Yeah.
Okay, you turned it on.
Yeah.
What did it teach you?
Well, I think it teach me a few things. Basically, like I said, how to work with AI in terms of coding and everything. But it mostly told me about, what we said, AI is an intern. It's an overly confident intern. So I don't know if you guys realize that most of the time, large language model is trying to do its best to impress you. Even it doesn't know, it will pretend it's know. Sometimes that's the reason it hallucinates. Because, it trying to impress you. You give me a task. My great master give me a task. I have to obey. I have to deliver. Right? So that's something I learned from that.
Okay, I guess this is a general question, both for the way you program, but also if you do have such interns, how do you get the intern to do something that's genuinely useful?
Well, that's pretty hard. That's pretty hard. But at least, the first step is we want it or they, AI or human, to admit, I don't know. So, since the very first version, since my actually very early project, dealing with AI, I'm trying to find that over eagerness of trying to answer something. And sometimes, I started from the beginning, I said, if you don't know, just say, I don't know.
And does that work?
Sometimes, like I said, problems are just suggestions.
Right.
Sometimes it will follow the suggestions. Sometimes it will not.
Yeah, it seems like it wants to less say that it doesn't know than it's not known.
Yeah.
Right?
Yeah.
Like,
So
not my fault.
yeah. So that's something, and to tie it back to what we talked about, in last episode, that's also something, we want, if we really want to put agents into production, we want the agents not so over eagerly to pick up some task. You should stay back when we realize this is not a task for they, right? Something like that. So it's pretty hard. And the way we, deal with that, is basically not only through prompts, but also through guardrails we'll talk about later.
Okay. So how do you improve it, right? You have the first version.
Yeah.
And you see it's bluffing.
Yeah.
How do you, what do you do next? You're done vibe coding, or
Yeah. Well,
or AI assisted.
AI assisted, but I think any product need to be tested. A drug need to be tested. A new website need to be tested. So everything we build need to be tested. So we actually brought in some human beta testers to look at the results, not just look at one report. But we actually ask these people to subscribe to Health Buddy for multiple months, so they can look at a series of reports. And, thanks to their generosity, we actually collected some feedback, human feedback about this. So one of these is too generic. It's not as insightful. It's covering a lot of basics, but it's not, in my situation, I need to know the basics, of course. But after a while, basics are no longer useful to me, right? I already know my way around this. Now I need to know the up-to-date, in-depth stuff. But it's lacking the in-depth stuff.
I think this is an important point to linger on for a little bit about how you did the beta testers and got feedback, because typically when you do things at scale, you do A/B testing, your feedback is only yes or no, or a little bit better, a little bit worse.
Yeah.
But you're actually asking people, human people, what words they would give as feedback. Too generic, right? Too much basics.
Yeah.
That's much more valuable, isn't it?
Yes, and I think it's a very because a lot of questions are not yes or no. Is this insightful to you, right? You cannot really ask that question. It's not really even if you can, the answer wouldn't be that valuable to you. So, and more importantly, the test users, right? We realize, later there is actually an issue here. Is we want a variety of test users. Maybe somebody who was newly diagnosed with the condition. Maybe the basics would be very useful to them, right? And maybe somebody is diagnosed for over a decade. Then the basics, they already know, they're the expert, right? They don't need this. They just need a little bit, catch me up. Right?
So you need you need the variety across people and within people, getting the feedback in not just yes, no, or good, bad, or 1 through 7, but a creative expression of what would have made it better.
Yes. And so that's why, we always say, we need to include human in the loop. Whenever we design something AI, we need to include human in the loop. And human, a lot of time, is that how we close the feedback loop. That's the most important thing, because you can think about we have the reviewer and the researcher and the reviewer. That's some kind of feedback loop, but we cannot let AI take over. We have to be the driver. over there. So the human users, their feedback is the ultimate feedback loop. We feedback to not to the researcher, but to me, to the design of the system and figure out, okay, this is something not right.
And so what did you change after that feedback?
Well, we start twisting things, and actually it goes well with the episodes of this podcast because the first thing I look at is the prompt. Can I enhance the prompt? And I like you said, can I just simply say, give me something more insightful, right? Or give me something I don't know, right? Try to guess what I don't know. But we already know, from episode 1, the guessing game, is not AI's strong suit. So that's one thing we learned. But there are actually a few things, and that's why we're talking about this. This is not something specific to Health Buddy. This is the lesson I learned. I think you can use for building any AI system. Is first, your prompts are alive. Treat them as live documents. Maintain them. You have a version 0, that's where you started. We talk about it, in episode 1, right? You start with something very simple. You start adding things to that. You start tweaking it. You start deleting stuff from that. You try to optimize that. You start, adjust that because it doesn't work, whatever you work. We can make all the modifications when we want. But what I'm suggesting is a live document is you might want to keep some kind of different versions of the same prompt. Say if something doesn't work, you can easily roll back to the latest working version of the same prompt.
What do you use for version control of prompts?
Several tools. I'm an engineer by training, so GitHub is always my best friend. So I've been using GitHub for my prompt versioning. But then I realized, when I started, consulting or training, professionals, not everybody is comfortable with GitHub. So we started finding, these more user-friendly tools. For example, something like Notion. I use Notion a lot, for versioning, prompt and things like that.
Now, your prompts obviously include variables and stuff. Do you just have variable like $ stuff as part of your prompt, or do you keep the prompts, the documents, pure text and assemble them later?
That's very interesting. So to explain that a little bit, so there is a difference between an exact prompt and the prompt template. So a prompt template can do similar things. Well, exact prompt can just do that one thing. Well, whereas a prompt template can do similar things. For example, if I'm asking the researcher to research on a certain topic, that topic can be a variable where it can vary from, bone marrow cancer to long COVID, right? You don't have to have 2 separate prompts for, these 2 conditions. You can just use $ or whatever to mark, this is a variable. Next time, just plug whatever condition you put in there. So that's a very efficient trick for prompting. We didn't talk too much about that, but we're using that a lot. Particularly, you're not using the chat interface. You're using API. We're using prompt templates with variables to do that. Most of the time, I store the templates. I don't need, because I can plug in whatever I want.
So within the templates, you have placeholders?
I have placeholders. I have placeholders for these variables.
What about like a little bit of business logic? Like if it's, maybe some people have different preferences. So where would you put like little if statements? Inside the prompt template or outside?
That's a very interesting question. Until very recently, until the final design of Health Buddy, which we're going to talk about next episode, I always do the conditional logic in code, not in prompt. Because that's why we develop, or at least one of the reasons we develop programming language is to handle conditional logic. So using our philosophy in this podcast, we should use the best tool for its use. Coding clearly is the better use
Makes sense.
of conditionals. But recently, things changed. Why it changed? Remember in episode 2, we talk about what's different from agentic workflow to a full agent system is how much autonomy we give it. When you keep the conditionals in code, the large language model cannot escape those conditionals. You are hard coding these conditionals into their life cycle. But like you suggested, if we keep the conditionals in prompt, it can basically make that decision. You will decide, oh, should I go to this one? If this is true, if this is not true, it has to make that decision itself. So we basically give it more freedom, more autonomy to make decisions. We're making it more agentic.
Amazing. Okay, so all right. So your pro tip number 1 was the prompt is a living, breathing document.
Exactly.
Okay. What other learnings?
Well, the second one is, of course, you should trust your human test users. Because like I said, we should always take control. As human, we should always take control, and we are the final tester or evaluator of the product, right? It's good, it's not good. Why it's good? Why it's not good? And one thing is, there are actually two tricky parts to this. A is, as developer, sometimes we love the things we create so much, we will pretend we're experts, but we're not. Like in my particular scenario, I build this thing because I'm not an expert. If I am an expert of these medical conditions, then I don't need Health Buddy. So we spend so much time build this thing that at the end we love this thing so much, we choose to ignore whatever negative voices we hear because we are the expert. We are the ultimate expert. No, you're not. You're not. You have to treat these valuable things into their put them, they should be your true north. That should be what you're heading to. The second thing I think, regarding to that, it's a little bit contradictory, and we'll talk more about that in the next episode, is with a particular agentic system, too much human control will tank it as well. You have to have ultimate control, but it's not too much, it's not too rigid. Remember, you need to give it enough autonomy so it can actually, make proper decision. You give it enough wiggle room and flexibility and things like that, so you will still be creative, but following the rules.
Interesting. So listen to the users, but not too much?
Not too much. Not too much, particularly if you design an agentic system.
Sometimes they don't know what they want, right?
Sometimes they don't know. Yeah. So sometimes you have to, guide them. Sometimes you have to guide them.
Okay, so the prompt is a living document.
Yeah.
Your user feedback is your true north, but sometimes, most of the time.
Most of the time.
At least it's a direction. Yeah, okay.
Yeah.
What else?
So the next thing I think, is what I realized when I started build something real, like Health Buddy, is what people are looking for, what people are paying for. Well, Health Buddy is free. Nobody's paying for that. But if you're a consultant and AI product people are paying for, they're not paying for these fancy tech demos. Right? You have a very complex, shining thing that, use all the trendy technologies. I don't know if people would pay for that. A lot of times, what I actually experience is boring things like Health Buddy. It does the search for you. It does the research for you. It summarizes things for you. Because it actually, these little boring things correspond to some business process people do every day. And like we said, we can elevate that process through these things. So, this is the thing, if you're into cars, you can see how many Lamborghinis you see on the street versus how many, Honda Civic you see on the street. the fancy tech demo is like building a Lamborghini, right? You build that fancy car, and everybody will say, "Wow, you have that," but how many people will actually pay for that? And versus how many people will actually pay for a much cheaper but more reliable Honda Civic? So that's something I learned because back in the day, and if you put on the academic hat, we always shooting for the fancy, trendy thing because academic research is that way. We're chasing the thing,
Right.
right?
Yeah.
But when you make it more practical, when you start building real things, it's different.
Because people need to rely on them.
Yes. So and keep in mind, the fancier you go, the more complex your tool, your product is, and the higher chance it will break. So you might want to keep it simple. A Civic is good. A Civic is always reliable and gets you from point A to point B. That's what people want, right? Don't sell them something they don't want. That's also an advice I would give my younger viewers is I think during your job interview, a lot of time they're not looking for something like a fancy show of tools. I can master all these things. A lot of time they're looking for something real, like this is a small problem, but I use AI or whatever to solve the problem. I think that speaks in more than a show of tools.
I see. Because if you have like a flash of brilliance, that could be kind of due to luck. But if you have something that you could do and solve a problem, in your words, you've automated it. If it's automated, then it shouldn't be. The most important thing is reliability.
Yes. Because think about Health Buddy, right? The actual user of the system, they are hand free.
Right.
The only thing they do is they subscribe to a keyword, and they will continue to get this report. So they I think in this way, the whole system, the whole process is actually transparent to the user. And I always love this saying, what's the best service you get? It's the invisible service. You never see them. You never see a housemaid doing cleaning in front of you. You never see them, but it's always clean. It's always organized. So the best service for user is transparent to the user. User doesn't even know that service exists or how it works, but it just delivers.
That's really insightful. So then, okay, so you made these changes, you made these wins, you had the feedback loop, but it sounds like there were still some sort of issues, right? Some limitations in the health
Yes,
study.
actually, there are quite a few. The first problem is I noticed, and my test users point this out the most, is consistency. Some weeks the reports are really good. Some weeks they're not that good. Sometimes they say, okay, this is so useful, this is so insightful, I never heard of something like this. I would talk to my doctor right away about this. That's the most fulfilling moment I need, right? And sometimes it's just it wastes me another 5 minutes.
That's not that big a deal, right?
It's not that big a deal, but we want it to be more consistent in a way. It's not that the higher bound is so high and lower bound is so low.
But you don't want to reduce the higher bound.
I don't want to reduce the higher bound, but I do want to raise the lower bound a little bit. So I want to basically reduce the variance between that, but not reduce the higher bound.
What if you just don't send an email if it's not that exciting that week?
That's something is very interesting because, again, like we said, evaluation is something really hard to do. So letting AI to decide if it's not that interesting is maybe it's the next step. But, so far, I think AI is struggling and looking at that.
I see.
And that's something, we definitely should look in.
That was like a fourth agent or something?
Yeah, maybe a fourth agent, and maybe, maybe something else, maybe in the combination of an agent and actually deterministic code to determine, something is interesting enough, things like that. But we did do something to that effect, but not through an agent, through a different way. The second thing is basically when this is a learning experience to me, like I keep saying in this episode. So the thing I built together is brittle. I mean, I'm just taking things from Initev Dan, this whole agent structure.
But it doesn't sound brittle. What does it mean, brittle?
Brittle means I don't have a systematic view of, I do have a logical systematic view of the whole process, but I don't have a technical systematic view, meaning, okay, so this thing should be actually claimed as a web service and should have an API here, exactly like that. So this reviewer agent will talk to the researcher agent through these APIs.
Oh, okay.
I'm just duct taping things through my loose code. Okay, so this is what the research agent created. Now the reviewer agent will read that.
So they talk to each other through just text outputs.
Exactly. So it's brittle in a few ways, because one thing is, what if the researcher generates something that the reviewer cannot read?
Right.
Then we'll break the whole thing.
Yeah, I see.
Right? And what if the researcher didn't generate anything?
Just empty.
Just empty. That also breaks.
There's no error recovery within the system.
Exactly. So the whole thing is brittle. But in order to put everything together in a week, I have to take shortcuts. I have to make assumptions. I have to use duct tape to glue, super glue, to put things together. But you wouldn't drive a super glue car on the highway, right? That's a little bit too adventurous, right? So that's something. But the first version you design is always brittle.
How are you noticing these glass ceilings? Is it some of the output is coming back? You notice that the consistency they told you about.
Yeah.
The brittleness, did you see it fail, or was it just something you knew as a
because
design?
Sometimes I will get a report, this daily workflow didn't run,
okay.
and things like that, or users complain to me why I didn't get my weekly report and things like that.
Okay.
Right. So that's basically that something. And the next thing I think is I think it's a deeper thing, is, do you want your agent, your AI agent, we said is basically an LLM as the brain with multiple tools and context, and so basically enhanced, super powered large language model. But you actually have two ways to do that. You can have a super strong brain, right? You can have a very strong brain, meaning, the powerful large language model. Then you have weaker tools, right? Or you can have a weaker brain, but stronger tools. Of course, you can have stronger brain with stronger tools, but a lot of time that translates to more compute and more cost and things like that.
Okay.
So a lot of times the trade-off is stronger brain or stronger tools, right? So what I realized is actually tools actually matter a lot.
What are the tools you're talking about?
So when we say tools, say search.
Okay.
What kind of search you're using? Are you just using something like Google
Right.
as a search? Or you're using integrated search, meaning the AI is directing, generating the search keywords and then do the search. These tools, the selection of the tools, Google would be the simpler, weaker tool comparing to AI. Directed search would be the powerful tool. Most of the time, the more powerful tool is useful, and that's for comparing to you can have a weaker brain and more powerful tool that give you better results, because a lot of times we shouldn't rely on, like we said, prompts are just suggestions, and the only way you can control that brain is through prompts, right? But the tools are different. A lot of time, these tools you can actually hard code your logic into these tools.
And you had originally in this first version had primarily hard-coded?
Not really, because I was duct taping things together, right? So I'm just using whatever tool I have.
It would have been better to hard code?
It would be better to put certain things deterministic than rely on large language model, because that's probabilistic.
Oh, I see. Because they're less reliable than
That's less reliable.
certain hard-coded areas. I see.
Exactly. And so we need to have a way to tell, for this task, we want it to be more deterministic. And then, we don't have to rely on, the brain. We can just rely on a certain tool, a strong tool to get it done.
The brain is kind of like the orchestrator of all the agents.
Exactly.
Okay.
Exactly. Not of all the tools.
Of all the tools.
That's one agent.
It's one agent.
Yes,
I see.
it's one agent.
I see.
The brain is the large language model, is controlling when to call which tool.
Okay, and just to clarify, so there are times when you do want it to be able to make that control, and other times when you don't, and that decision itself is above the level of the ability of the brain or LLM itself. It's something you as a designer needs to
Exactly.
spend some time thinking about.
Exactly.
Okay.
So that's when I say, when I was duct taping things together, I don't have the systematic view of what should, because I never built it. Before you ever build it, you don't know which things you want stronger control, which things you want less control. Not everything. Some things we're going to talk about next about ethics. Clearly, that you want stronger control, right? But but then other things, for example, how to regulate the output from each agent, you don't know what kind of things you would get, right? So that's through trial and error.
So it's a bit of a delegation question.
Yes.
I see.
Yes.
That makes sense.
Yes.
Okay, so recapping. This was your first attempt at the Health Buddy. You did it pretty quickly. You did the feedback loop with human input.
Yeah.
You found these different glass ceilings like consistency and brittleness and safety and the dumb tool problem. But, and you had a lot of learning experience from it, like the living document and all the rest of it. But there must have been something keeping you going. It sounds like it's all challenges. There must have been some flashes of insights and brilliance.
Yes, that's, when we hear from the test users that, this week's report is really good, that's definitely keeping me going. And whenever I send this out to people I know, and they give us positive feedbacks, right? So that's something's going. And also, something keeping me going is I am learning. Besides the Health Buddy, I'm learning how to better work with AI on a fairly, even small scale, but fairly complicated projects. Because we're already talking about 3 agents working together on their own. Nobody has to touch that. Nobody has to push any button. They kick off the task on their own every day.
Yeah, that's so cool.
Right?
Yeah.
So it's something new. So in a way, I'm upskilling myself. That's what keeps me going, because we talk about PhD. What PhD actually give you is curiosity, right? Whenever you see something new, you okay, I'm learning this. I want to learn more. I want to get more into what are these agents? How do I have better control of those, finer grain control and things like that. So that's keeping me going too.
This is awesome. Now, okay, so you have a system. It's brilliant.
Yeah.
It's flawed. It's giving you lots of learning. That's all great. But it's useful to people in an area, like you said at the beginning, that's very, very important. This is life or death. You're not building like a Pokemon recommender, right? It's not something that's whimsical or what doesn't matter if it makes mistakes.
Yeah.
Here it matters, right? That's why you talked about hallucination is a problem and being overly confident, overeager interns.
Yeah.
People will be reading this, potentially making decisions based on it. Of course, you put disclaimers, this is just to keep looking further. I'm assuming you put something like that, right?
Yeah.
But this is a very brave thing for you to do as well, right? Because this is something that truly matters. And as you said, ethics probably must have played an important and huge role. Tell us about that.
So, again, I don't want to talk too much about the theory or the big topics about ethics, but this is all about my personal experience. My exact personal experience is, can I live with myself if my tool gives somebody wrong advice, right? And somebody who's desperate for insightful information. Can I live with myself, right? That is actually a very heavy question I keep asking myself, when building something like this. And I'm dealing with somebody who actually need, help, right? So it's very tricky. And I made sure No, I cannot live with myself if I give somebody a wrong advice or even misleading information to things. So, which means I have to I have to make sure the information is at least reliable, or maybe just useless. Right? Useless just means there's no zero value. But misleading means there's negative value. But in this particular scenario, negative value doesn't mean loss of money. It could mean loss of life.
Yeah.
That's heavy.
That is heavy. Let me ask you, this may be a bit of a tangent, but for the listeners and viewers who may not know, you've done a lot of research on a lot of other things as well.
Yeah.
And to hear you say that, you have to ask yourself, would you be able to live with yourself if your system provides misleading information? But you've done an enormous amount of research on literally misleading information and suicide.
Yeah.
Did any of that factor into or play into your decision making, or your building, or your ethical considerations?
Yes. My academic research, in explainable AI. So we're trying to peek into that black box and trying to understand why it did certain things a certain way. And it did give me that, so it functioned like, a guide to me, right? I cannot blindly trust AI. Even if I cannot tell if this information is insightful or valuable or not, my assumption is, until it's verified, it's not insightful, it's not valuable. So I think that's something, it's very important. And the suicide research is actually reminding me these things that, how important or how dramatic a damage it could done, to people, in real life. We're not talking about test subjects. We're not talking about, lab work. We're talking about real lives. So I think this is really important, I think.
Okay. Suppose we're working on a project like this in our lives, and probably it's not going to be as heavy as life and death.
Yeah.
But we will always have the same risk of like the confident intern.
Yeah.
How can we diagnose that risk, let's say?
So I think what we're gonna do, we talk about all these things throughout this episode, how I deal with that. So what we can do is we can put this summarized version of what we call an AI health scorecard, and you can download that maybe from the comments and from our website, and you can use that to assess what you're building. Is it healthy enough to move on? Right? So that's how we publicize our personal view of building things. And you can at least use that as a reference.
It's an AI health buddy, not a health buddy built with AI.
Yeah. So it's a AI health scorecard. It's more like, did it pass? Did it pass the health check? You would only continue on it if it passed the health check.
That sounds great. So so I've built an AI project. I download this AI health scorecard to check my own project's health, and I can see how you solved it, or I can figure out how dangerous it is in my project and go from there. Is that the right approach?
That is the right approach, but we're here to help. So in the next episode, this episode, we talk about the problems. We talk about how we diagnose the problem. Next episode, we're going to present to you our cure, or at least amendments to these problems. How do we make it better? How do we make it, more trustworthy, more insightful, more consistent, and things like that. So I'm going to share with you more lessons I learned from this. So maybe that would help you with your, endeavor in AI.
Wonderful. Thank you, Jie.
Yeah.
Look forward to seeing you all in the next episode.